Well, first and foremost, I'd like to ask our panelists here if you could please introduce yourself.
Yes, I'm Dr. P. Manas, joined the ATAS MCH and Family Welfare, come State Nodal Officer, Shillong.
I'm Dr. A. Ling Do, additional DMHO in the Office of DMHO East Khasi Hills.
I am Dr. E. Shadab from the RT-PCR Lab, Pasteur Institute.
I am Dr. Jeremy Boam from Civil Hospital, Shillong.
I am Dr. Batkapar Simyong, currently working in Ganistas MCH Hospital, Shillong.
Okay, now that we have our panels here, let's start off with the first question first. Till date, how many vaccines have reached the final phase of the clinical trials? And when do we expect these vaccines to be administered to the general population?
Yes, till date, there are 4 vaccines which are in the phase 3 or clinical stage. And these are, one is Covishield. This is manufactured by Serum Institute of India, Pune, in collaboration with AstraZeneca. And number 2 is Covaxin. This is manufactured by Bharat Biotech International Limited, Hyderabad. This is in collaboration with Indian Council of Medical Research, India. And this is also in phase 3. And the other one is Zygo-VD. This is manufactured by Cadila Healthcare Limited, Ahmedabad, in collaboration with Department of Biotechnology, India. This is in phase 2. And the other one is Sputnik V. This is manufactured by Dr. Reddy's Lab, Hyderabad, in collaboration with Meghalaya National Center, Russia. This is in phase 2. And we have also other vaccines, but these 4 are till date in the clinical stage.
Now, a question from Grassroots Shillong, an NGO, wants to know how will vaccine help us in reducing the spread of COVID-19?
In the COVID vaccination, the vaccine will evoke an immune response, which will thereby, bring about a reduction in the severity of transmission of the infection.
Thank you, Doctor. Now, is the proposed COVID-19 vaccine a sure shot prevention?
No vaccine is 100% efficacious as at present. However, we do advocate, that people should get vaccinated in order to attain herd immunity, so as to protect the vulnerable population, a vulnerable group of the population.
One question from Aimal Alan Sangma. Aimal Alan Sangma wants to know, when will the vaccine arrive in Meghalaya? And when can we expect COVID-19 vaccine administration to the healthcare workers in the state?
Okay. As of now, these vaccines, we are waiting for the authorization from the emergency use from the Drug Controller General of India. And so, as soon as they get the license from this unit, I think they will be available. And then as the time for the vaccination to Meghalaya, as of now, we don't know yet, but we are expecting in the middle of January and February.
Okay, since it is a new vaccine developed in just a few months, is it safe to vaccinate the general population? And are we expecting any adverse effect that may lead to abnormality and fatality from it?
Okay. This vaccine, it's true, has been developed in a very short time. However, there's been absolutely no compromise in their clinical trials. Perhaps steps that used to happen between phases has been shortened. But this just means that the regulators have worked harder and longer. Yes, we do expect some adverse effects to happen, because this is what is expected in all vaccination. So what should we expect? We expect pain, swelling, fever, a little bit of tiredness, maybe fatigue. And these are expected for all vaccinations. Allergic reactions may be there, but these are very rare and short-lived. So why do these allergic reactions happen? These probably happen because of the components of the vaccine, not the virus itself or what you're going to use in the vaccine. And this vaccine is so high profile that, it's been, every small little thing that has happened to it has been magnified. What we should be looking at, and what the government is looking at, is equitable access of this vaccine to our people here.
Okay, thank you, Doctor. Now, when everything is starting to come back to normal, for example, the retesting of the COVID-19 positive are exempted during discharge, and quarantine period reduced. Is there a need for vaccination?
Yes, I think there's a need for vaccination because, as we know, this COVID infection, like the immunity which the people which have been infected by COVID, the immunity does not last long, and the antibodies wane away. So they may be suffering from the disease again. So therefore, vaccination is very important.
One Deity Mauto asked this question: why are people not excited about this vaccine, although it is considered by experts that it is a breakthrough in the fight against COVID-19?
They are not excited. Agreed. This happened, and this is seen with any other vaccines that has come out in the past too, which we call it the vaccine hesitancy. This is very common, and certain factors do influence, like for instance, complacency, then convenience and confidence, and also the trust that they have in the public health system. That is the vaccine hesitancy that they have.
Okay, and Deity Mauto also wants to know if the COVID-19 vaccine will be made mandatory to all citizens. If yes, why?
As of now, the COVID vaccination has not been made mandatory. People are still being given the option of, choosing to be vaccinated or not. But from the department itself, we do advocate vaccination of all because that is in the interest of protecting the community.
Okay. Now, why then the vaccine when most of the COVID-19 survivors in Meghalaya are cured without the vaccine? Doctor?
That's a very good question. And it is probably mind-boggling to our common people why the government is stressing so much on coronavirus here, why we're really highlighting all these things. So when we say 1% fertility, we're talking about mortality rates. We're forgetting morbidity rates here. When we talk about 1% fertility, for every 1% of the population that dies, 19% of the population will have long-term heart problems, 12% of the population will have lung problems, another 2% would have neurological problems, and other things. These are called morbidity rates of the coronavirus disease. Think of the socio-economic burden that the state has to carry with this. Think of how much it will crush our public health system if we have all these diseases coming to us. Not the diseases, the factors, these morbid rates because of coronavirus, because one person died, and the infection that he has caused to others who may not have died, who may have recovered, but the long haul of the disease is such that they have something called a chronic disease in them. So all these causes the government to think carefully and say that this COVID-19 disease is not something that we should take lightly. We should take it very seriously because it causes such a burden on us.
So all the more seriously important to prevent the spread. Can a doctor just prescribe normal viral medicine for positive patients as they did for COVID-19 positives at the hospitals?
Well, the answer is definitely no, because simplicity because of their toxicity and adverse effects involved with the drugs. So there may be people with underlying medical condition, those with heart disease, with chronic kidney disease. So especially the antiviral medication, they are very toxic in that sense. So I'll give an example. For example, even in the case of antibiotics also, antibiotics mean they are used for bacterial infections. So even antibiotics also, we cannot just use randomly. You cannot just, only when they are indicated, only we use antibiotics. So forget about the antiviral medication. And another problem is like antibiotics, like the problem of resistance. We use a lot of antibiotics in hospital, and people they buy over-the-counter medicines nowadays with antibiotics. So the problem of resistance now is it's coming up. And even if we use antiviral medication, it doesn't prove that these these drugs or these medicine will work on those COVID positive patients. And there are clear, guidelines from the Ministry of Health, Family Welfare when these drugs should be used, especially in COVID-19 patients.
Thank you, Doctor. Is the vaccine 100% efficient to protect us from contracting the disease? If not, what are the odds? And what are the probable side effects of this vaccine? And how often can it occur?
I think earlier on our doctor has already informed us that no vaccine is 100% efficacious. Will it prevent us from the disease? Yes, of course it will prevent us from getting disease, the COVID-19 disease. It will probably prevent us from ending up in hospitals, but there's a small chance that you are still contagious and you might carry the virus, and you may be still spreading it. Therefore, such true and tried methods of social distancing, wearing masks, etc. is still advocated. Probable side effects of the vaccine, we have already informed you that there's a very rare chance you might get allergic reactions. Again, these are very short-lived, and the other types of side effects that you get, tiredness, fever, pain, swelling, etc., or soreness at the site of the vaccine will be there also. How often can it occur? As you know, the United States and other European countries are just started these giving out these vaccines. So we will see. Studies must be going on right now. This is a very fluid situation. We will catch up with them, and we will inform you.
Does immunity after getting COVID-19 disease last longer than protection from COVID-19 vaccine?
This again is an ongoing study. We know that from the short experience that we've had in the 10 months now, that there is no long-lasting protective immunity after getting the COVID-19 infection. In fact, antibodies wane off very quickly within 2 to 3 weeks. So there is no protective immunity with the natural infection. With the COVID vaccine, we have heard only, we have read, we have heard only, as you know, vaccination has just started. They say that protection will be there for about 6 months, and it'll probably be similar to the flu influenza vaccine, and we might have to take it annually.
Now, are there any other flu vaccines that can help in preventing or minimizing the effect of COVID-19 disease?
Actually, there are none, because coronavirus vaccines, they're totally different from the flu vaccines that have been used for influenza infections. So they're
if I may weigh in, vaccines are specific.
Yeah, specific for each and every.
Specific to each disease.
And as the CDC says, Centers for Disease Control and Prevention, USA, like you can take a flu vaccine. Like there are cases where there are co-infection. There's a cases of co-infection with COVID-19 with common flu like influenza. So this, as CDC says, like this may help reduce the severity of illness in those type of patients. But currently there are no such flu vaccines which can protect or you can give you protection from COVID-19.
What percentage of the population needs to get vaccinated to attain herd immunity to COVID-19?
Herd immunity, as defined by the World Health Organization, is a concept used for vaccination. It's also known as a population immunity. So, in which a population can be protected from a certain virus if a threshold for vaccination is reached. So it differs from one infectious disease to another. It differs from one organism to another. So in the case of COVID-19, that is not known yet at the moment. Current evidence and current studies are undergoing at the moment, but we do not know yet what percentage of the population to be vaccinated in order to attain that herd immunity. But we have learned from previous infectious diseases like in the past, for example, like measles and poliomyelitis and all. So around maybe 2/3 of the population needs to be vaccinated in order to attain that herd immunity.
Well, that's it for today, but don't worry, Meghalaya Answers will be back on our next episode with our experts to answer more questions related to COVID-19. Stay safe.